I have a mole. This is what I was thinking, Adele. I don't know what this. Have a look at what this question says. I have a mole that has been confirmed by the GP that it could be cancerous. I'm on the GP's waiting list for removal, but they said it could be a few weeks before I am seen. I'm very concerned and worried. How quickly can you make an appointment? Well, it depends on, well, actually, it doesn't depend. We're usually pretty quick for appointments anyway. By pretty quick, I would say, God, Amy should have given me some tips. I think a week, probably a week or two. We can see you pretty rapidly. We've got quite a few surgeons now, and so we should probably be able to see you within a week or two. Having said that, we've had a few recently. What we usually do, because we've got this see and treat service, we've got a sort of system where people will send us a photo, and that will first of all let us give you a price without having to come to see us, but will also give us an idea of whether it's a bad thing or not. Because we've had a couple recently that, well, literally two in the last couple of weeks, which have looked bad on the photo. We think that looks bad, so we will certainly, if it's a mole that looks like it's gone cancerous, you've got to be a bit careful, because you've got to think about things like melanoma. There are other types like BCC and SCC which are less worrying, but certainly melanoma is a bit of a worry. So if we are concerned about melanoma, we will get you in, and if not on the day, in the next day or two, we will certainly get you in. And I've done someone a couple of weeks ago, and I know that Costas treated someone like last week, and both times we put them at the end of the clinic where everyone agreed to just stay on, but just because melanoma, you kind of want to get off as soon as possible. So if you send us a photo and we think it looks worrying, we will get you in very quickly. But if it's just kind of like, if it doesn't look that worrying, we'll still try and get you in quickly, but it'll be like a week or so. Because when you say your GP says it looks cancerous, there's different types. If it looks like a BCC or SCC, we can be a bit more relaxed about that. Yeah, they're normally like red, crusty, often sun-exposed areas, often in older people. So they're less of a concern. They can be left a bit longer than a melanoma, which is kind of a mole. So if it's a mole, if it's a brown mole that is concerning, I think it's reasonable to expedite that. I wouldn't say you really want to leave a few weeks before getting that off, because melanoma you want to get off as quickly as possible. So we would certainly do it less than a few weeks. We would probably try and do it within a few days. And as I say, the last couple we've done actually on the day, but certainly within a few days, because we try and help with that. So yeah, for sure, send us a photo. It's the thing to do. WhatsApp it. Don't know what the number is, but if you go on the website, can you do it on Facebook? There's a WhatsApp button on Facebook, isn't there? Anyway, if you go on the website, I think there's a button somewhere that says WhatsApp a photo or something.